Welcome to the Addiction Counselor Examination, also known as the ACE exam tutorial. The purpose of this exam is to evaluate a candidate's knowledge and skills that are required to be a competent counselor in an alcohol and other drug or substance use disorder treatment setting. The ACE exam was put together after comprehensive development and review by practitioners, administrators, and educators from throughout the United States, and is based upon relevant and scientifically validated standards, which includes the specific competencies and standards established by the U.S. Department of Health and Human Services, counselor competencies addressed in the nationally distributed Addiction Professional and MAT Counselor publications, input from a national survey of over 200 subject matter experts, which established the relative importance of the required knowledge and skills competencies, an evaluation of the exam questions by a subject matter expert panel that reviewed and evaluated every question in order to make sure that the exam appropriately measures the necessary knowledge and skills of an individual serving as a counselor in an AOD or SUD treatment program. And finally, the entire exam and exam development process was subjected to a scientific validation process, a psychometric evaluation, by a nationally recognized test validation expert, in order to make sure that the most important parts of the job are adequately represented and tested in the examination, and that the knowledge and skills of the candidates for certification as an AOD counselor are uniformly measured and tested. All of the ACE exam questions are based upon the material within 3 publications: the U.S. Department of Health and Human Services Addiction Counseling Competencies, also known as TAP 21, the Addiction Professional, which was developed and published by the Brining Institute, with contributing authors representing practitioners, administrators, and educators from throughout the United States, and the MAT Counselor, a training manual developed by Brining Institute that relates to the specialized skills and knowledge required in counseling within a medication-assisted treatment program. All of the exam questions were developed based upon the information contained within these 3 textbooks. If it is not in these books, it will not be on the exam. In preparing for the exam, we recommend that you watch this tutorial, highlight the areas pointed out in this tutorial within the books, and then go back and study those highlighted areas within your books. The tutorial will go through the material rather quickly, so use this format to stop and replay the video as often as you want. The reason most cited for failing the exam is not studying the material. You may have already learned most of the information that is contained in the books, but don't assume that your past knowledge will help you pass this exam. The exam contains 100 multiple choice questions. There will be 4 possible answers for each question, and you will select the best answer based upon the material in the books. The 4 subject areas on the exam are understanding addiction, treatment knowledge and application to practice, professional readiness, and counselor competencies. And the tutorial slides will indicate when these areas are covered. So get your books, grab a highlighter and a pen, and let's get started. We'll start with the Addiction Professional, from which most of the exam questions are taken. We'll use this first slide to show you some common features of all the slides to help you keep track of where you are in the tutorial. At the top, it tells you which book you are in. At the bottom, there's a little icon picture that also helps you keep reference to the book that you're in. There's also a chapter indication for the book, and then the title of the area that we are covering on this particular slide. This is how all of the slides are set up, which takes us to the first chapter. Chapter 1 has a lot of good information about professional competency and certification, specifically certification laws in California, but there will be no exam questions on this chapter. Chapter 2 covers history and overview, and there is a lot of information that will be tested on in this chapter or from this chapter, and the important parts to know are everything that is in bold font, especially within the chronology of chemical use and abuse. For example, know about the Washingtonians, know about the 18th Amendment, know about Narcotics Anonymous, know about the Hughes Act. Again, know everything that is bolded in this chapter. And then also, on the last page of the chapter, under a few facts, that starts with, according to the U.S. Assistant Secretary for Health, know everything in that paragraph. In Chapter 3, know about the various community efforts at addressing problems of addiction. The Minnesota model, the recovery homes, hospitals, managed care, outpatient, non-residential treatment, be able to know what the components of those models are, know how to distinguish between them. The article in this chapter about biblical Christian counseling is included because it is an approach utilized by a substantial number of counselors, and the professional counselor should know about this approach even if the counselor has different beliefs. Here are the three things that you should know for the exam. The first one is that the biblical Christian counseling model declares that the only way for change is by having an inner transformation. That's the first paragraph of that article. The second thing that you should know, under the causal elements of the biblical model, number 5, the role of the counselor is to help the individual through the initial process and help provide biblical wisdom and guidance. And the third thing is that the biblical model says that unless a person is given a new life, he or she will not have within them the power that is needed to break addictions. Those are the only 3 items that may be asked about this article in this chapter on the exam. In Chapter 4, know who makes up the members of the nuclear family and the family of origin. Know the difference between those. Know the relationship between community and organization as it relates to the family system. Know about the family system and its subsystems, and know about the family community boundaries, such as rigid, disengaged, diffused family members. Know what those characteristics are, be able to distinguish between them. Know that in 1990, the U.S. Census showed that 21% of all families were step families. Know about family homeostasis and know what that means, and also be able to understand and distinguish between the various roles, like placater, blamer, family hero, scapegoat. Know what all of those characteristics are, all of those roles are, and again, be able to distinguish between all of them. So if the exam asks you to identify which family member is the one who acts out, abuses alcohol and drugs to take focus off dependent and unsolvable family problem, that is probably the scapegoat. In Chapter 5, know which Latin word personality comes from, know the differences and be able to distinguish between id, ego, and superego, and know about the information contained in this chapter about the Myers-Briggs test. Also know about Erik Erikson's 8 stages of psychosocial development, and know the general differences exhibited by well-adjusted versus addictive persons in dealing with fears and anxiety. In Chapter 6, know the definition of the terms provided: ethnic, nationality, race, minority, bigotry, prejudice, bias. Be able to distinguish between each one of those terms. Know the meaning of each one of those terms. And also know and be able to distinguish between ethnic and cultural stumbling blocks and building blocks. Know the factors that increase women's risk for alcohol problems, and also know the people generally included in ethnic groupings in alcohol research. Know the general prevalence of drinking among different ethnic groups, and also know the following: that ethnic and cultural considerations in a therapeutic group setting enhance the group process and promote treatment goals. Understand that minorities may be underrepresented in addiction therapy and why. Understand that a counselor and client awareness of their own prejudices can minimize resistance and promote treatment goals. And understand that counselors should be educated about the norms and lifestyles of minority group members in order to discern which behaviors are symptomatic of personal psychopathology and which are attributable to cultural influences.